This is a massive rethink because now we're talking about the root causes of what's going on here as opposed to the symptoms. Symptoms versus disease is an extremely important concept to get around. Many years ago, I was an emergency room physician. A gentleman came in his late 40s with excruciating pain in his left shoulder. Could barely move the shoulder. He's also a little short of breath. He's also a little gray and ashen. We take a listen to his chest, and the heart rate's not quite regular. So as opposed to focusing on the shoulder, which is his main complaint, we decided to do an EKG on him. He's in the middle of a heart attack. We treated him with lidocaine IV, which is one of the things we use for treating a heart attack, and as the heart pain quieted, the left shoulder pain went away completely. Had we stayed focused on the symptom, treated him with a cortisone shot in the shoulder and sent him home, he'd have been dead before he got out the door. We are doing this day in and day out to people suffering with chronic pain and suffering with depressive disorders. We are treating the symptom. We are not treating the disease. This is what has to change. Let's talk about inflammation for a minute, because it's a very complex topic in the body. Inflammation in and of itself is not only not a bad thing, it's absolutely crucial for healing. And it comes in a lot of different forms. So inflammation can occur when you get a cut. So you abrade your knee, and then you get redness that comes into the area. There's a white cells mobilizing in order to get rid of the infections, the bacteria that may be in the area. If you have infection, if you have inflammation secondary to a bacteria sitting in the knee, then your treatment is not going to be a painkiller, but your treatment is going to be an antibiotic, right? If you have hay fever, the problem is that you are allergic to pollens, to grasses, to trees, to cats, to dogs, to your spouse, or to your house. And you're going to get nasal congestion, your eyes are going to be red and watery, and you're going to feel miserable. But would I treat this with an antibiotic? It's an inflammation. No, you treat this with an antihistamine, because histamine is what is creating the inflammation in the body. So you want to be smart in understanding what it is that's mediating the inflammation, what it is that's causing the inflammation in the body. And it's only if you understand what's causing the inflammation that you can begin to get to the root cause of what's happened. In pain, well, I think the evidence is exceptionally strong that pain, depressive disorders, anxiety disorders are evidence of inflammation in the brain. But what is it that causes inflammation in the brain? Well, the answer in one sense is pretty straightforward. The answer is microglia. So what are microglia? This is a picture from microglia. Microglia are little tiny cells in the brain. They constitute about 6% of all of the cells in the brain. They are the innate immune system of the central nervous system. They are pretty much the only thing that really creates inflammatory factors in the brain. This is an incredibly important discovery, because if we know what it is that mediates the inflammation, we have a target. We have something we can look at and say, okay, what is it that turns on the microglia, that causes them to start creating inflammatory factors? And then once we know what it is that causes the inflammatory factors, we can also understand what we need to look for in order to stop the inflammation. And we can also know what to look for in terms of being able to treat the inflammation in the brain. So our focus here is now turning this around and looking at chronic pain, depressive disorders, anxiety disorders as predominantly symptoms of a neuroinflammatory disease, inflammation in the brain on fire. That fire is mediated by microglia. And to give you some perspective on what this looks like, this is a cartoon. Just to show you around, basically half the brain is comprised of glia cells. All right? We thought all the actions was in the neurons, but actually half the brain is comprised of glia cells. Glia cells, three main types. There's oligodendrocytes. The oligodendrocytes, the oligodendrocytes are those blue things right there, and what they're doing is coating the neurons. They insulate them so that you don't get short-circuiting. You have your astrocytes, and notice that the oligodendrocytes, the blue things, the astrocytes, which are the green things, okay, they're connecting things. But the astrocytes, among other things, form the blood-brain barrier, so they are very selective about what they allow to get into the brain. They also have a huge amount of influence in terms of neuronal signaling. The little guy sitting off in the corner, E, is a microglia. One of the fascinating things about the microglia is that they are not attached to anything else in the nervous system. They kind of float around. So they can move around the nervous system and they can go to areas of injury. These guys also morph incredibly. They change from this kind of a state all the way into a full cell-like macrophage where they can actually eat and kill bacteria and viruses. So since we understand that the microglia are what's mediating the inflammation, then let's back up and say, okay, what is it that activates microglia? And by the way, if you want to know what microglia activation looks like, you've all experienced it. You ever had a cold? You ever had the flu? Fever, chills, generalized feeling yuck. That's microglial activation. So the microglia are kind of the force field, the shield surrounding the brain, moving about the brain, protecting the brain. One of the things that will impact the microglia is infection. So, have we had problems with chronic infective processes? Question we need to ask our patients. Infection can come in a lot of different forms. Epstein-Barr can come in the form of HHV6. It can come in the form of Lyme disease. And I think that one of the things we're looking at in chronic Lyme, which affects about 25% of patients who do get Lyme disease, is that we're seeing an ongoing activation of microglia because they've been stimulated for so long, and thus the inflammation in the brain stays active. Another thing that can do it is hypoxia. Now, what's hypoxia? Hypoxia is loss of oxygen to the brain. Well, that doesn't happen often. Well, actually it does. It happens to about 5% of the population every single night. It's called sleep apnea. And only about 15% of people with sleep apnea have been diagnosed with sleep apnea. So we have a huge number of people in this country walking around not getting enough oxygen to their brain every single night, causing inflammation in their brains. Physical trauma, concussions. We've seen it in what happens in these guys who play with the NFL. All right, the average lifespan, the average number of years that an NFL player spends in the NFL is, football fans, about 4 years. The average lifespan of an NFL player, 54 years. These guys are having their heads beaten day in and day out from when they're little all the way through their 20s, rarely into their 30s. And they don't survive it. This is why we have stopped our kids in soccer, and the little ones, from heading the ball. This is why, after 3 significant concussions, we don't let the kids play anymore, because we can't risk having them have additional concussions. Because the inflammation in the brain doesn't turn down. It stays on. And there's progressive destruction of the brain as a result. So physical trauma is a big deal. But then there's more stuff. Psychological trauma. Psychological trauma comes in a lot of different forms. It can come in the form of a rape, massive, overwhelming psychological trauma. But it also comes from extended periods of long-term stress. And we're beginning to understand that extended periods of long-term stress actually damages the brain. We see micro damage in the brain. And as soon as you start damaging cells in the brain, guess what? Microglia swing into action in order to initiate an inflammatory and repair process. But if that stress is ongoing and doesn't stop, the microglia stay upregulated and inflamed, and now that inflammation isn't repairing the brain, it's actually starting to break down the brain. So psychological trauma is ongoing, and I don't know the numbers, but it's huge. All of us have experienced periods of extreme stress. And we've seen cases where following periods of extreme stress, that people then subsequently get into a relatively minor accident and disaster ensues. So I have one woman who came in to see me who had tendonitis in her shoulder. All right, the shoulder's inflamed. She has been through multiple orthopedics workups. She has been through physical therapy. This has been going on for years and years and years. Okay, the tendonitis started 5 years ago as a result of a sports injury. Or did it? We push back a little bit in her history and we ask more questions. She is presently 25 years old. Problem supposedly starts early 20s. Historically, we find when she was 12 years old, she was raped. And she's not told anybody about this before. And she has PTSD. Now, she has PTSD not because she was raped, though many, many people do, but she has PTSD because as she's telling me this story, she is in tears, she is shaking, she is totally reliving the experience. And now the rest of the story starts evolving out. So sitting in her system, what has been primed in the system, is this inflammatory process that started with a very major, horrific psychological trauma that never got addressed. And so we sent her to therapy. As she's working through that process, one of the things that came up in one of the images with her was that she had been pinned down on the very shoulder that hurt. There was, in fact, a memory of the psychological trauma as well as the physical trauma she sustained, sitting in the shoulder. When that was released, when we got to that point, it was then relatively easy to fix the shoulder with physical therapy, with some acupuncture. And she got complete recovery. But you've got to get to the underlying thing or things that are creating the problem. Celiac disease. I have a 19-year-old who comes in to see me who is severely depressed. He's being seen as depressed. He's not complaining of other things, he's depressed. He's depressed enough to attempt suicide on 2 occasions. The medications aren't working. If we step back and we say, okay, this is a neuroinflammatory disease. What creates inflammation in the central nervous system? One of the answers is celiac disease. So we test him for it. He has celiac disease. We're now about 8 months into his treatment. He comes in. Before, he would not look at me in the eye or talk to me. He was always hunched over. He's now looking me in the eye. He's totally engaging me. He has future thoughts about what he wants to be doing. And we're starting to wean off his antidepressant medications. But he's gluten-free. His brain is waking back up. So we have all these things going on, and it turns out that they're cumulative. There's a point at which all of these traumas, 1 + 1 + 1 doesn't equal 3, but it equals 6. Because now what's happened is the microglia are turned on at an permanent inflammatory state. And even if we get rid of all of these things, we're still going to have all the symptoms. And the symptoms are going to be sleep issues, waking up during the middle of the night, problems falling asleep, chronic fatigue, difficulty, focus, and concentration, Any of this sound familiar to any of you? Depression, anxiety disorders, and pain. Be they headaches, be it fibromyalgia, be it back pain, but pain. All of these are symptoms of ongoing inflammation in the central nervous system. Chronic pain and depression are symptoms of inflammation in the brain. This is a radical rethink of these conditions. This is the end of silos, where psychiatric problems are psychological issues, period, not physical issues. Where pain is purely physical issues and there's no psychological issues involved. We have seen this for years, and we pretended that those barriers were legitimate, that those divisions were legitimate. They're not. We have to think holistically about these problems. We have to see how the mind and the body are indeed one, not because we believe it, but because the research tells us it is. Inflammation is a result of cumulative assaults on the brain. We have to think not cause and effect, but process. We have to see how these things evolve in somebody. We have to quit thinking of them as the event. So total recovery is possible. But it's only going to be possible if we treat the root cause and not just the symptoms. And it's only going to be possible if we treat individualized issues as opposed to cookie cutter processes in addressing each of these issues. You come in with back pain, there must be a problem with a nerve root in the back, we give you an injection, next. No. And in order to do this, we are going to have to take the time to listen. We're going to have to listen to your story. Your story is crucial. The narrative of how you got sick helps us understand why you're staying sick, and most importantly, helps us understand how you can recover. I have been treating patients for 30 years. This book is the culmination of my understanding of what I've learned from all of you and from all of my gifted colleagues and professors over the years. This is what I hope will be the beginning of the most productive 30 years of my life. Because for the first time, we have an understanding of the neurophysiology of these conditions in such a way that we can begin to make a huge difference. My hope for this book is that it will change lives. My hope for this book is that it will change the way we think about these conditions and get us much, much better answers. Do we have all of them today? We do not. But this is the beginning of how we can begin to understand them. This is the end of treating symptoms. This is the end of chasing the bright and the shiny, and the beginning of treating the cause and really helping people attain total recovery. I thank you for your support all these years, and I thank you for coming this evening.